We are delighted to have with us here at CHEST 2014 Dr. Jean Elwing. She's from the University of Cincinnati College of Medicine. Thanks for stopping by.
Oh, thank you very much. It's my pleasure to be here.
So you presented here at the conference. How did that go?
Oh, great. I think that was a very successful session.
Okay. Let's talk about some issues then.
Okay.
Many clinicians rely on RSVP to guide clinical decision making, yet patients with right heart strain frequently have comorbid diagnosis, which may represent non-PAH pulmonary hypertension. What are your recommendations for managing these types of patients?
Well, I think we just have to remember that your right-sided systolic pressure will be elevated in any form of pulmonary hypertension, and we have to use our clinical clues, our history, to guide us down which path that pulmonary hypertension may be from. So I think we have to use that as part of our tools to evaluate a patient.
Echocardiography often suffers from non-standardized reporting, making it difficult for some physicians to diagnose pulmonary hypertension. What measure do you see as a means to circumvent or overcome this problem?
I think this is communication. I think we ask for things in our personal life the way we want them. We order food exactly how we want it, but we may not order an echo the same way. So I think we have to ask, what am I looking for? I want to know about the RSVP, RVSP, excuse me, but also we want to know about right-sided size, function, and structure, and we don't often get that in as great a detail as we'd like. So in order to get that information, sometimes we have to start asking for it. And we have to take the time to call back and ask, can you please give me more information on the right-sided structures, or can you add a few additional tests to my echo?
So where does this communication solution begin?
Okay, actually, I think it comes from whoever's reading and doing your echoes. So whoever's the director of your echo lab, it might be your colleague, or it might be someone in a different institution. But I think you just have to open those lines of communication, because you will never get what you don't ask for. And that will limit your evaluation of patients, just as you asked me about people with elevated pulmonary pressures. If you get more information, you can make a better evaluation and diagnosis.
Okay. What processes do you recommend for increasing utilization of diagnostic tools such as right heart cath to definitively diagnose PAH?
I think that comes from getting the right information, okay? We don't want to overuse invasive tools, but we want to use them when appropriate. So if we get the appropriate information from our echocardiogram, we evaluate patients in a detailed way. That will help us to know when to go on to an invasive procedure and increase the likelihood we will be doing procedures on patients who have true disease. So I think it's all about getting the information, putting that together, and then ordering the invasive procedures.
Very good, thank you. Will you come back and share information with us again?
Of course,
Okay.
anytime.
Thanks very much.
Thank you.